So any declarations of interest? Seeing none, can we confirm the minutes of the meeting of June 19th, 2023? Are those meetings confirmed? Are those minutes confirmed? Great. We have received 16 communications items, which will be held on file with the Board of Health Secretary. Motion to introduce reports. Member Bauer, please.
Thank you, Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled as follows: Ottawa Public Health's 2023-24 Respiratory Season Preparedness Plan, 2022 Annual Report and Attestation to the Ministry of Health, 2023 Operating Capital Budget Q2, Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, contracts awarded for the period of January 1 to June 30, 2023, and 2024 Ottawa Board of Health meeting schedule to be received and considered.
Is that carried? Thank you. We'll go through the consent agenda. So board members, if there's any item you'd like to speak to, please indicate and we'll hold it. So item 7.1, Chair of the Board of Health verbal report. We will hold for my verbal and a motion. Item 7.2, Medical Officer of Health verbal report. We will hold for Dr. Etch's verbal and delegations. Item 7.3, Ottawa Public Health's 2023-2024 Respiratory Season Preparedness Plan. We're going to hold for a staff presentation. Item 7.4, 2022 Annual Report and Attestation to the Ministry of Health. Is that received? Thank you. Item 7.5, 2023 Operating and Capital Budget Q2 Board of Health for the City of Ottawa Health Unit Status Report. Is that item received?
Hold, please.
Hold? Okay, so we'll hold that item. Item 7.6, Delegation of Authority, contracts awarded for the period of January 1st to June 30th, 2023. Is that received? A quick one? Sure, go ahead.
Apologies. I had noticed on the matrix that was submitted that one of the contracts did not have a vendor assigned, and just wanted to see if we could get clarification on that. It might have been an omission or...
I think Kibria can speak to that. You're talking about item number 8, which is
Yes.
courier services for the pickup and delivery of water samples for Ottawa Public Health? Yep.
Yes.
So either Andrew or Kibria, do you recall the vendor name? And we can certainly correct that in the record as well.
Yeah, I'm not sure why there's no order number there, so we'd have to look into it and get back to you.
Okay. No, I appreciate that. If it's
circle back?
amended later, that's fine. I just wanted to ensure that the record was correct.
Okay, we'll make sure we follow up. Thank you, Member King. Okay, item 7.7, 2020, oh sorry, is 7.6 received? Thank you. Item 7.7, 2024 Ottawa Board of Health meeting schedule. Is that carried? Great. We also have one item, information previously distributed, titled Chronic Disease Prevention, Restricting Marketing of Unhealthy Food and Beverages to Children, Health Canada consultation. Does anyone want to lift the IPD, or can we? We're good? Okay, wonderful. So we'll go back to the first held item, which is my verbal report. So in August, I had the privilege of attending the annual conference of the Association of Municipalities of Ontario, along with my council colleagues, Riley Brockington and Wilson Lowe. On the sidelines of the conference, we had the opportunity to meet with the Minister of Children, Community and Social Services and the Minister of Health, as well as with representatives of the Ontario Liberal Caucus and the Ontario NDP Caucus. Ces réunions étaient très positives, les représentants provinciaux exprimant leur intérêt et leur appréciation pour le travail de santé publique à Ottawa, en particulier en ce qui concerne les domaines de pratiques novateurs tels que les centres de santé et de bien-être des quartiers. During the conference, the Minister of Health addressed a key concern of the public health sector. Specifically, as of January 1st, 2024, the province is restoring the previous 75% provincial, 25% municipal cost-sharing funding formula and providing an annual 1% funding increase to all public health units through 2026. This is extremely welcome news for the residents of Ottawa, who count on Ottawa Public Health to provide them with programs and services that promote well-being, prevent disease and injury, as well as protect the health of our community. This news comes at a time when Ottawa Public Health is working to reduce a backlog of preventative health services, such as immunization and dental treatment, that has built up over 3 years of pandemic response. Also, the burden of infectious diseases is greater than it was pre-pandemic, including tuberculosis in the community, as well as respiratory and other infections in congregate care settings, such as long-term care facilities and childcare settings. The COVID-19 pandemic has demonstrated to all of us the value of public health units in preparing for and responding to health emergencies. They need to be properly funded to do the important work of monitoring and managing infectious disease outbreaks and preparing for the next health emergency. Je tiens à remercier le gouvernement de l'Ontario de reconnaître l'importance du travail effectué par les bureaux de santé publique locaux et de répondre à l'appel du secteur de la santé publique en faveur d'un cadre de financement stable et prévisible qui permettra à nos résidents de rester en bonne santé et en sécurité. For more than 20 years, Ottawa Public Health has been actively involved in Pride festivities in our city. This year's Capital Pride theme was Get Proud, an urgent call to mobilize against hate and to strive for progress while celebrating together more loudly and proudly. Again this year, OPH partnered with Community and Social Services to mark the launch of Pride Week in Ottawa by raising the Pride flag in front of the Mary Pitt Centre at 100 Constellation. The event was held the morning of Monday, August 21st, and was live streamed on OPH's Facebook account, allowing the community and employees to participate virtually. I was attending the AMO conference on that day and could not attend in person, but I am thankful to member Brent Bauer, who participated on behalf of the Board of Health. On Sunday, August 27th, I was happy to be able to participate in the Pride Parade along OPH colleagues, friends, and family members. The Pride Parade is always a fun and colorful event, and I enjoyed this opportunity to celebrate with our community and with some of my fellow members present. Je remercie toutes les personnes qui ont assisté et participé à ces événements, ainsi que le personnel de SPO qui a aidé à organiser ces activités pour promouvoir l'inclusion et le bien-être de la communauté 2S LGBTQIA+ d'Ottawa. I would like to acknowledge that next Wednesday, September 27th, is Rowan's Law Day, which is marked annually on the last Wednesday of September to raise awareness of concussion safety. Rowan's Law is named after Rowan Stringer, a young athlete from Ottawa who died in the spring of 2013, and this year is the 5th anniversary of it being enacted. It was the first law in Ontario and in Canada addressing concussions and athlete safety in sport. The law establishes removal from sport and return to sport protocols for young athletes if a concussion is suspected. Nous pouvons tous montrer notre soutien à la journée de la loi de Rowan en promouvant la sécurité contre les commotions cérébrales, en partageant nos histoires et en apprenant à connaître les signes et les symptômes d'une commotion cérébrale. September 30th is the National Day for Truth and Reconciliation. First recognized in 2021, this federal statutory holiday honors the children who never returned home from residential schools, the survivors, their families, and communities. C'est aussi l'occasion d'attirer l'attention sur le passé pénible et les effets persistants du système des pensionnats. Leading up to the National Day for Truth and Reconciliation, We can take the time to learn and reflect on the meaning of this day by reading the Truth and Reconciliation report or a book by an Indigenous author, watching an Indigenous film on residential schools, listening to a podcast or webinar hosted by Indigenous knowledge keepers, or taking a moment for quiet reflection on the impact that colonization has had on the lives of Indigenous peoples and the actions that we can take to address racism and advance Indigenous rights. And then we can share what we have learned with colleagues, family, and friends. September 30th is also Orange Shirt Day, an Indigenous-led grassroots commemorative day intended to raise awareness of the intergenerational impacts residential schools have had on individuals and families and to promote the concept of every child matters. The orange shirt represents the stripping away of culture, freedom, and self-esteem experienced by Indigenous children over generations. A live national broadcast will commemorate National Day for Truth and Reconciliation and Orange Shirt Day on Parliament Hill in Ottawa on September 30th, 2023. People can join in person or watch the broadcast online to memorialize the children lost to the residential school system and honor survivors and their families. Apprendre et commémorer la vérité de notre histoire collective auprès des gardiens du savoir, des Premières Nations, des Inuits et des Métis est un élément essentiel du processus de réconciliation. Une responsabilité partagée par tous les Canadiens qui nécessite d'agir non seulement en ce jour, mais tous les jours. During last spring session of the Ontario Legislature, Goldie Gamari, the MPP for the local riding of Carleton, introduced a private member's bill, Bill 93, also known as Joshua's Law or Life Jackets for Life. S'il est adopté, le projet de loi obligera les parents et leurs tuteurs à s'assurer que leurs enfants âgés de 12 ans ou moins portent un vêtement de flottation individuel ou un gilet de sauvetage lorsqu'ils sont à bord d'un bateau de plaisance. At this time, the laws in Canada only require that there be one properly fitting life jacket or personal flotation device for each person on board a recreational boat. There are no laws making it mandatory for passengers to wear a life jacket or personal flotation device while on the water. We know that prevention is the most effective way to avoid injuries and deaths related to drowning. In fact, Ottawa Public Health has been a member of the Ottawa Drowning Prevention Coalition since 2002. Other members of the coalition include SHIO, the Life Saving Society, the Canadian Red Cross, the Ottawa Fire Service, Ottawa Paramedic Service, Ottawa Police Service, and Ottawa's Recreation, Cultural, and Facility Services, among others. Drowning is preventable, yet there are still on average 152 preventable water-related deaths in Ontario each year. Bill 93 seeks to prevent some of those deaths by ensuring that children 12 years age or younger wear a life jacket or a personal flotation device while on the water, rather than simply requiring that one be on board. Having reviewed the draft bill, OPH staff have expressed support for it. Board members may have also seen in our communications package for this meeting a letter from the chair of the board for Sudbury and District's Public Health expressing support for Bill 93, and that letter was endorsed by the City of Hamilton's Public Health Committee. Similarly, I am hopeful board colleagues will join me in expressing support for Bill 93, and I've asked Member Bauer to introduce a motion on my behalf in just a moment. This will conclude my verbal report. Member Bauer?
Thank you, Chair. Motion as follows: whereas drowning is preventable, yet there are still on average 152 preventable water-related deaths in Ontario each year. And whereas prevention is the most important and effective way of reducing morbidity and mortality from injuries, including drowning. And whereas at this time, the laws in Canada only require that there be one properly fitting life jacket or personal flotation device for each person on board a recreational boat, and there are no laws making it mandatory that the life jacket or personal flotation device be worn while on water. And whereas Bill 93, Joshua's Law, Life Jackets for Life, seeks to prevent drownings by ensuring that children 12 years of age or younger wear a life jacket or PFD while on water, rather than simply requiring that a life jacket PFD device be on board. And whereas Ottawa Public Health has reviewed Bill 93, Joshua's Law, Life Jackets for Life, and is supportive of it, therefore be it resolved that the Board of Health for the City of Ottawa Health Unit express its support for Bill 93, Joshua's Law, Life Jackets for Life, and request that the Chair of the Board of Health write to the provincial government to convey its support and urge all parties to vote in support of this private member's bill.
Thank you, Member Bauer. Is that carried? Wonderful. Thank you. Do we have any questions on my verbal report? Seeing none, can we carry it, or can we receive it? Wonderful, thank you. Item 7.2, Medical Officer of Health Verbal Report. Over to you, Dr. Etches.
Sure. Thank you. Bonsoir. Unasukut. Kwe. Good evening, everyone, and online. Yeah, okay. It's since 2017, so some of you would remember that, but others are new to the Board of Health, but that's when we first declared an overdose crisis, and we noted the need for all levels of government to act. Our city, unlike many others across the country, has seen a significant increase in the harms caused by fatal and non-fatal drug use and drug overdoses. This is worsened by the increasingly toxic and unpredictable supply of unregulated drugs and by rising unmet needs for health and social service supports that could prevent and mitigate the harms from substance use. So Ottawa public health initiatives related to substance use include our health surveillance and reporting function, and our work in this area is continuing to evolve, as I will mention below. And last week, also useful when we consider the Ontario picture and Ottawa part of it, Public Health Ontario released a report on overdose and substance-related toxicity deaths. It also describes the trends in fatal substance-related toxicity broadly, and it combines data on deaths due to alcohol, stimulants, benzodiazepines, and opioids. In it, Public Health Ontario noted that coinciding with the COVID-19 pandemic emergency, starting in March of 2020, deaths due to accidental alcohol and drug toxicities increased by 37%. That was from 2020 to 2021. And there was a disproportionate number occurring among younger populations during this period. These deaths were mostly attributed to opioid poisonings, where fentanyl, primarily from an unregulated drug supply, directly contributed to the death. And although opioids were directly responsible for the vast majority of alcohol and drug toxicity deaths in Canada, there has been an increasing attention on the harms caused by other substances, either alone or in combination with opioids. The report noted the use of multiple substances has been associated with worse outcomes compared to people who use only one substance, including an increased risk for toxicity-related morbidity and mortality, and reduced effectiveness of the toxicity-reversing agents, such as naloxone, which only reverses the effects of opioids. So work to improve these numbers requires many different interventions, given the complexity of the challenges and the importance of getting at complex root causes. As a society and in our health and social systems, we need to invest and use all the evidence-based tools in our collective toolbox to address mental health and substance use health. Le travail qu'il nous faut accomplir afin d'améliorer ces chiffres nécessite de nombreuses interventions différentes, compte tenu de la complexité des problèmes et de l'importance de s'attaquer aux causes fondamentales. En tant que société et dans nos systèmes sociaux et de santé, nous devons investir et utiliser tous les outils dans notre boîte à outils collectifs pour aborder la santé mentale et la santé liée à l'utilisation de substances. Mental health challenges and homelessness are both on the rise, and they've been made worse by the pandemic. The increase in mental health and substance use challenges, at least partly, are a result of unintended consequences of the measures to mitigate the spread of COVID-19, as that resulted in service reductions across social and health systems, increased social isolation, increased toxicity and unpredictability of the unregulated drug supply, and increased job loss and financial insecurity. So to improve the health and wellness of individuals and communities, it is necessary to address social inequities as well that are often at the root cause of ill health, such as poverty, racism, and colonialism. And thank you for highlighting how we can learn more about that as we mark September 30th. We see that the risks of negative outcomes are higher for people with low incomes. And we spoke about prevention already this meeting. It's one of our key functions. Certainly, Ottawa Public Health works in partnership to prevent substance use harms through supports to parents for early childhood development. Early childhood is a significant determinant of health. Pour aider à prévenir les événements indésirables dans l'enfance qui peuvent augmenter la probabilité d'une consommation ultérieure de substances. Santé publique Ottawa a continué à investir dans le programme Bébé en santé, enfants en santé, qui aide les parents à créer un environnement familial sûr et stimulant et à donner à leur enfant un bon départ dans la vie. Children with a healthy start are more likely to develop resilience and coping skills that protect them from substance use in the future. The program helps to identify and address developmental or behavioral or mental health concerns early on by providing information, resources, screening, and referrals for early intervention services. We know addressing these concerns early on can lead to improved outcomes for children and families and prevent more significant challenges down the road. We have other work, of course, underway on prevention, including with youth, and I look forward to bringing you more about this as we present our new action plans related to our strategy, which certainly continues to prioritize mental health and substance use, and that is planned for our meeting in December. But only by working with a wide range of partners on a comprehensive, multi-pronged approach will we come close to addressing the scale of a problem that has caused so much unspeakable tragedy and suffering. So Ottawa Public Health, as one organization, has joined many to form a vast network of partners responding to this crisis. Partners include the city's Community and Social Services Department, police, paramedics, firefighters, the coroner's office. It includes hospitals, pharmacies, community health centers, as well as social services and housing organizations. Also part of this network are people with lived and living experience in substance use, as well as providers of mental health, substance use health, and addiction services. No one agency oversees all these sectors, but people understand we cannot make progress without integrated approaches. And so together, we've established the Ottawa Overdose Prevention and Response Task Force and the Community Action Plan. The action plan has 3 goals which continue to resonate, and they continue to articulate the work underway: to reduce harms from substance use health across the lifespan, to prevent stigma and promote substance use health, to expand those harm reduction initiatives and improve access to comprehensive services for mental health and substance use health integrated with social services. So the Overdose Prevention and Response Task Force is in the process of being reinvigorated to include more partners in recognition of the complexity of the situation and the multiple types of supports and responses required. Ottawa Public Health will continue to dedicate resources to providing what we call the backbone or the convening support to the task force. Santé publique Ottawa continuera à consacrer des ressources à ce que nous appelons le pilier ou le soutien aux convocations du groupe de travail. And we look forward at the November Board of Health meeting to bring you an update about the expansion of this multi-sector overdose response strategy to address and respond to the overdose crisis and toxicity crisis and the impact on communities. The update to the board will include the launch of the second phase of our dashboard on mental health and substance use health. As I mentioned, we are going to work to provide more timely and detailed information about mental health, addictions, substance use health, and determinants. We've heard that community members are seeking enhancements to our public reporting of overdoses. So this dashboard will track and measure trends to better support system planning, program development, and service coordination and evaluation. Ottawa Public Health has been working for multiple years to keep adding to our data sources where the data comes from partners, such as hospitals, paramedics, and others, to be able to examine substance use health from multiple angles and inform various aspects of prevention and response. We continue to advance data sharing agreements, and we're proud of the way the dashboard will present information on prevention right through to the availability and the effectiveness of treatment options. Another way Ottawa Public Health is collaborating with partners to address the overdose crisis is through the City of Ottawa's Community Safety and Wellbeing Plan. As part of this plan, Ottawa Public Health is working with partners to develop non-police alternatives when responding to mental health and substance use crises. And bien que Santé publique Ottawa ne fournisse pas directement de traitement pour les troubles liés à l'utilisation de substances, notre équipe oriente les patients et plaide en faveur d'un meilleur accès au traitement. So while we don't provide treatment for mental health or substance use disorders directly, one example of how we advocate and link and support linking people to treatment is through an initiative led by the Ottawa Paramedic Service. Ottawa Public Health is working with the Paramedic Mental Wellbeing Response Team and the Royal Ottawa Mental Health Centre to develop pathways to directly connect residents into the Rapid Access Addiction Medicine Program, supporting patients with treatment with Suboxone, and a focus here is on the unhoused population. Finally, Ottawa Public Health is a collaborating partner on the Byward Market Balanced Community Task Force. This is focused on enhancing the mental health, safety, and well-being of everyone who lives, works, and visits the Byward Market. Evidence-based approaches to improving substance use health include ensuring that people have a supportive social network and are able to contribute to their community. And one of the task force initiatives helps with this. It's a pilot project called the Block Leader Program. It's a training and outreach program developed by the community to restore its leadership. So block leaders from the community work 2-hour shifts 2 to 3 times per day. And the Block Leader program is empowering the street-involved community to take a leadership role within their community as members of the growing Block Leader team work alongside street-involved individuals to support them, connect them to services, and help them clean up the neighborhood, discussing and building on strategies to reduce violence and crime, and increasing respect, compassion, and safety. To date, over 70 block leaders have been trained, and there continues to be interest in this program. Other areas of focus for the Byward Balanced Community Task Force require support, such as to identify safe spaces for all members of the Byward community. Safe spaces contribute to building that community connection and cohesion, and it's also true for people who are currently homeless and unsheltered in the day. Looking to provide safe spaces for this community is integral for community cohesion, safety, and well-being. Linking people to primary care and mental health and substance use treatment remains a challenge in the Byward Market and across the City of Ottawa. And so we're continuing to work with healthcare partners as they seek to address the need for more treatment by building on existing services funded by Ontario Health. Now, given the high risk of toxicity and related death from substance use, Ottawa Public Health has also been collaborating with pharmacies and other health and social service providers to meet people where they're at with harm reduction services. We continue our provincially mandated role to expand access to naloxone, the life-saving medication that can temporarily reverse an opioid overdose. And so there are currently 24 active partnerships, including with hospital emergency departments, the police, paramedic service, and other providers. Et en 2022 seulement, plus de 10 000 trousses de naloxone ont été distribuées dans le cadre de ce programme. And Ottawa has one of the highest rates of naloxone distribution among our peer health units. And there's another program also supported by the provincial government where 200 local pharmacies have distributed more than 25,000 kits in the first quarter of this year alone. So people want to be prepared to help. and there's a need. Thanks to the efforts of St. John's Ambulance, naloxone training is now part of what is taught in all first aid training courses. St. John's Ambulance also offers free online naloxone training and kits, as do the Red Cross and Respect RX Pharmacy's naloxone care program. Ottawa Public Health provides naloxone training to the hospitality and tourism sector, as well as the construction industry. In partnership with the City of Ottawa's Special Events Advisory Team earlier this summer, Ottawa Public Health supported large special events with overdose prevention and training resources, and we launched Party Safer, a free naloxone training course offered online. And together, these courses have reached more than 3,500 people to date. Of course, there's so much more that still needs to be done, which is why we're working with partners to address gaps in harm reduction services, such as to introduce drug checking and look at meeting the needs for safer inhalation. The coroner has shared data with me that currently in Ottawa, the majority of people are dying from exposures to multiple drugs at once and are smoking rather than injecting drugs. Along with consumption and treatment service partners, CTS partners, Ottawa Public Health is purchasing drug checking machines and will use the information to help keep people informed, people who use drugs and the wider community about the results. We're sharing the data on deaths due to inhalation with healthcare partners who will need funding from the Ministry of Health to implement solutions. We see that the current consumption and treatment sites in Ottawa are grappling with the changing landscape of drugs available, with staffing levels and the limitations of health and social service systems. CTS reversed over 1,100 overdoses in 2022. This is more than twice as many compared to 2020. Les sites de consommation et de traitement, les infirmières de santé publique Ottawa et les personnes chargées de la réduction des risques offrent des soins pleins de compassion dans un environnement très difficile. I want to thank the harm reduction workers for keeping people alive and connecting people to supports each day. Ottawa Public Health is mandated to conduct routine inspections, complaint-based inspections, enforcement, and public reporting related to consumption and treatment services. The CTS compliance requires sites to be responsible for keeping a perimeter 15 meters, around 15-meter perimeter from the building free of harm reduction supplies. However, we have heard from neighboring residents that there are significant incidents happening outside of this perimeter and much more broader in scope than the issue of harm reduction supplies. Neighbors echo the concern about violence in the area that people who use the sites report and reported concerns with safety and the Safer Downtown for All report. So Ottawa Public Health's Community Needle Retrieval Program is continuously reviewing program data and community feedback to make adjustments to the level of service for harm reduction, supply pickup, needle retrieval, adding needle retrieval drop boxes, increasing needle hunter route length and location changes. This is just one piece, right? In addition to previously established community liaison efforts, Ottawa Public Health, along with our city and community partners, are working to increase both formalized and informal avenues for community engagement and feedback. An example of this work, specific to Sandy Hill, Lower Town, and Byward Market area, has included the establishment of the city's Community and Social Services Department's new community engagement team. The comprehensive partnerships and approaches mentioned above are aimed at reducing the disorder, concerns, and harms in the neighborhoods most affected. It is hard to overstate the continued grief and the suffering that's experienced by individuals, families, neighbors, and entire communities, including businesses who have been impacted and are impacted by this crisis. Ottawa Public Health hears your voices, and we share our concerns. We share your concerns that this is an unacceptable situation, and we need all to be part of the solution. On August 31st, Ottawa Public Health joined people with lived and living experience, as well as the harm reduction community, to mark International Overdose Awareness Day. This is an annual event that remembers people who have experienced drug-related harms, including fatal overdoses, and acknowledges the grief of the family and friends left behind. And we continue to hear that stigma remains a major barrier for people accessing the supports and services they need. Stigma is present when people voice that harmful substance use is a choice rather than a medical condition. But we know, like other medical conditions, there are risk factors and evidence-based treatments for substance use that can be addressed and advanced. Stigma is behind assumptions that people with substance use that causes problems or risk of death is just really, it's other people, it's a homeless population. But we know that most people dying from drug toxicities die in their own homes when using alone. So a key message in our Stop Overdoses campaign is to not use alone and to always carry naloxone. We also promote overdose prevention tools like the free National Overdose Prevention Line and the BRAVE app that connect people who would otherwise use drugs alone with remote and anonymous supervision and overdose support. Still, people need to be able to reach out to friends and family, to have someone support them and be with them, and stigma often stands in the way. En effet, les jeunes doivent pouvoir s'adresser à leurs amis ou à leur famille pour avoir quelqu'un à leur côté, mais la stigmatisation est souvent un obstacle. That's why last week, Ottawa Public Health participated in a Working on Wellness festival. It was an event that brought together community partners working on mental health, substance use health, and physical health to keep learning together about how to build better supports, including a healthcare system free of stigma for people across all socioeconomic demographics. The event was organized by the Community Addictions Peer Support Association, or CAPSA, which represents people with lived or living experience with substance use. We've been working as Ottawa Public Health alongside this group and others on initiatives to reduce stigma and improve uptake and access to services to support the substance use health in our community. And I want to share a key principle that CAPSA promotes is to remember that the majority of the population uses substances, and we must continue to find ways to improve health of all people across the spectrum of their use, wherever they are on the location, whatever their location on this substance use spectrum. So as I said earlier, this means working in partnership to invest much more in many different evidence-based interventions, from prevention in early childhood and adolescence to supportive housing, to treatment capacity, and to safer neighborhoods. Knowing that I would be providing this verbal update tonight, I know that some partners and community members have registered to speak as public delegations, so you'll be hearing from them directly very shortly, and we're grateful for their work and their interest and collaboration to address this crisis in our community. I'm going to change to what may seem like a simpler challenge for us, which is catching up on routine childhood immunizations. L'immunisation pour enfants de routine est administrée tout au long de l'enfance et de l'adolescence et contribue de protéger contre les maladies telles que la rougeole et la polio. So most routine childhood immunizations are given through primary care offices, such as a family doctor or nurse practitioner, but 3 routine childhood vaccines, including hepatitis B, human papillomavirus, and meningococcal vaccines, are given by public health at grade schools, usually grade 7. And of course, you have heard the COVID pandemic disrupted routine childhood immunizations and school-based immunizations. So over the past year, Ottawa Public Health has been working hard to help children and youth catch up. During the 2022-23 school year, Ottawa Public Health mailed notices to parents of families with students born in 2005 and 2015. I'm just reflecting that I didn't get one, so that's good, whose immunization records showed missing or incorrect vaccine information. This past spring and summer, then automated voice, text, and email messages were sent to Ottawa residents in all grades where immunization records showed missing or incorrect vaccine information. And to help youth catch up on the HPV, hepatitis B, and meningococcal vaccines, usually given in grade 7, we held 64 clinics, catch-up clinics in 64 high schools. These catch-up clinics also offered tetanus, diphtheria, and pertussis boosters, which is usually given in primary care at age 14, but we noticed that was particularly lacking. And over 7,000 vaccines were administered through these clinics. Certainly, we also realized we needed to extend eligibility into grade 8, so we didn't focus only on grade 7 as usual. And to increase access to all routine childhood vaccines, particularly for people facing barriers to vaccines in Ottawa, in November of 2022, we expanded vaccine offerings in our large-scale community clinics and our neighborhood health and wellness hubs. So we have ended up hosting catch-up clinics at 26 elementary schools in priority neighborhoods, and 600 people have attended those, where we administered nearly 1,000 routine childhood vaccines. So you can see we're really in multiple places assisting, as we know that there are thousands of doses missed over the pandemic. And I want to note that this year we will be mailing notices again to students born in 2006 and 2016, and we're going to continue to work with Kids Come First, which has partners all across Eastern Ontario, to make it easier for children to catch up on missed routine vaccines. So children who don't have a regular healthcare provider can continue to book a routine vaccine appointment at one of our clinics or with a participating partner. And you can check out online Kids Come First Clinic Flow booking webpage for catch up on vaccines, or drop in to our neighborhood health and wellness hubs. The school-based programs continue, and I want to thank the team for making progress in this area. I guess that's the bottom line, that we're addressing the backlog in routine childhood immunizations, but it's going to take ongoing work. I know there are going to be some questions about other types of vaccines like COVID and RSV and influenza, so I'm going to just anticipate that will be covered later on our agenda when there is a presentation on the respiratory season. Il nous fera plaisir de répondre à vos questions liées à la COVID-19, les vaccins VRS, suite à la présentation de notre équipe pendant les racontes. So I'm happy to take questions on the rest of my report.
Thank you, Dr. Etches. So we do have a number of delegations on this item. We also have a motion from Councillor Carr relating to the overdose crisis. So Councillor Carr, do you think you could read that in now? Then we'll go to delegations, and then we'll go to questions from board members to Dr. Etches, and they can speak to the motion as well.
Excellent. Thank you very much. And thank you very much, Dr. Etches, for the update on all the work that is actually being done on opioids. I know as a member of Police Services Board, Community Services Committee, and Public Health, it's something I hear a lot about, and you know, looking at the statistics that we have, I think it would be very useful to have that bigger picture so that everyone can have that picture. And I know that work is underway, and perhaps this is a little bit redundant, but I think it's important to at least have it out there. So I'll just read it into the record. So whereas the drug overdose crisis, made worse by the increasingly toxic and unpredictable unregulated drug supply, continues to have devastating impacts and cause significant harms on communities and families across Canada. And whereas Ottawa, like many Canadian cities, has seen a significant increase in the harms of fatal and non-fatal overdoses since the start of the pandemic, and these rates have remained elevated. And whereas this complex issue is compounded by interrelated challenges of increased mental health concerns and an increase in the number of people needing homelessness services in the community, therefore requiring a broad, multifaceted response. And whereas Ottawa Public Health, along with a large network of partners, including the city's Community and Social Services Department, Community Health, Social and Housing Services organizations, people with lived and living experience of substance use, hospitals, pharmacies, emergency services, police, paramedics, and fire, mental health, substance use, health, and addiction service providers, and the Regional Coroner's Office have been working together on multiple coordinated and interconnected strategies and action plans to help reduce harms from substance abuse and save lives, including, but not limited to, the Ottawa Community Action Plan, the Community Safety and Wellbeing Plan, and the 10-year Housing and Homeless Plan to 2020 to 2030. And whereas the pandemic has further highlighted the need to address the inequitable access to community resources and reinforce the knowledge that to improve the health and wellness of individuals and communities, it is necessary to address root causes of ill health, such as adverse events in early childhood development, poverty, lack of housing, racism, colonialism, and other factors that influence health. And whereas Ottawa Public Health and the Ottawa Board of Health recognize that this is a crisis and there is a need for further actions to address these issues and respond to community needs in collaboration with community and partners. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit direct the Medical Officer of Health and the team at Ottawa Public Health to work with their various partners to increase public awareness and understanding of the work that is underway through multiple coordinated and interconnected strategies and actions plans. Further develop a comprehensive, multi-sector overdose response strategy to address and respond to the drug overdose crisis, its contributing factors, and its unintended consequences and people and communities. And increase the type of data available as well as the timeliness of the data published on Ottawa Public's Health, Mental Health, Addictions, and Substance Youth Health Dashboard to better inform policy decisions and the planning, development, and coordination of services and interventions. Be it further resolved that the Board of Health for the City of Ottawa Health Unit requests that the Medical Officer of Health bring forward a report to the Board on work to enhance the multi-sector overdose response strategy and the Mental Health, Addictions, and Substance Use Health Dashboard.
Thank you very much, Councillor Carr. So again, we'll go to delegations, and then we'll have opportunity for board members to discuss both the motion and ask questions about the verbal report. So our first delegate is conseillère Stephanie Plante.
Bonsoir tout le monde, est-ce que vous m'entendez? Est-ce que vous m'entendez? Can you hear me?
Sorry, we can't hear. Having an audio issue, conseillère? Just give us a second.
I'm unmuted.
It's not you, it's us, conseillère Plante. So just give us a second.
Is it our problem?
No, it's us, yeah. Darren, do you need her to keep trying so you can test?
Salut, est-ce que vous m'entendez? Est-ce que vous m'entendez? Oui, ça va mieux? Ah, good. OK, parfait. Merci beaucoup. Merci pour la patience. Les problèmes techniques, je pense, ont été résolus. Alors, merci beaucoup. Donne-moi 2 secondes. Avant que je débute, j'aimerais remercier la présidente Kit qui a eu le courage de me demander dès mon élection comment elle pouvait aider non seulement mon quartier, mais globalement, comment on peut résoudre ce problème qui est sans relâche. J'aimerais aussi remercier Mme Blais qui a géré les requêtes de la communauté avec empathie et un professionnalisme exceptionnel. Merci beaucoup, Mme Blais. I really struggled what to say today. This problem has tentacles that no one really understands the magnitude and complexities, but just to give you an idea, since I was sworn in November 2022, I've had 734 emails related to social disorder issues in and around consumption sites, 932 emails about the Byward Market, 590 emails about encampments, and 1,067 emails about homelessness just in Ward 12. I'm not saying this to make this intervention about me, but to give you an idea of how pressing the issue is, not just in Ward 12, but across the city, and how the overlapping crises can bleed into one another. The reality is, because this crisis has been ignored, no one is happy. The drug users are not getting the help or services they need and are being preyed upon by drug dealers, human traffickers who see my ward as a one-stop shop. Many journalists have reached out to me from Canada, France, Belgium, China, Mexico, wanting to see the King Edward and Rideau Strip. The ones that have made the trip have described scenes similar to war zones and referred to our opioid situation as, quote, worse than the downtown east side, quote, a humanitarian crisis, quote, the capital where people are dying and drug dealers are thriving. I don't know, oh, excuse-moi, là, j'ai perdu mon, donne-moi 2 secondes. I don't know what the solution is. Many cities are confronted with this crisis, and I've had fantastic conversations with councillors from Windsor to Montreal to Regina and Calgary. Locally, I've chatted with harm reduction workers, frontline workers, waitresses, retail employees, teachers and school administrators, early childhood educators, community associations, private security owners, small businesses, and the University of Ottawa, all of whom have been impacted by this crisis. I've also spoken to drug users who are living in what can only be described as horrific conditions and whose small and basic requests, a small apartment, regular check-ins, a warm meal, are not being met. Several things have crystallized in the last couple months. 1, while this is not a policing issue, we need to understand that there are nefarious elements that are weaponizing the over-concentration of services in Ward 12. 2, and Dr. Etch has already addressed this, we need better data. Our current data gaps mean that we only hear anecdotally from ambulance workers about where the overdoses are happening. And I look forward to this new way of seeing how the progress is going in our nation's capital. 3, we need better systems collaboration. There is the federal exemption for licensing of sites and safe supply, the provincial funding for consumption sites, and the municipal management of the fallout of these services. And no one is talking to each other or coordinating complaints or results. 4, while not necessarily the purview of public health, we need a good neighbor bylaw. Up until recently, many service providers did not consider anything outside their doors the purview of their organization. And as someone who lives off King Edward and has seen significant changes in my community over the last 10 years, I can confirm that this view is myopic and harmful. We are all in this together, and the term harm reduction needs to include the users, harms against businesses, schools, residents, housed and unhoused. On a le droit de s'indigner. On a trop souvent fermé les yeux sur cet enjeu, sur des humains et une communauté qui ont besoin de nous. Trop souvent, notre indifférence a pris le dessus sur la souffrance, le désespoir, le mal-être de ces hommes et ces femmes qui ne demandent qu'à être écoutés et entendus. Des humains avec un vécu différent. Ottawa compte maintenant 5 décès par semaine de surdose. Nous sommes capables de mieux que ça collectivement. Ce n'est plus l'affaire d'une seule personne, ce n'est plus qu'un seul palier de gouvernement, c'est l'affaire de tout le monde. On a besoin des cibles ambitieuses pour y arriver. On a besoin d'une ville ambitieuse. Thank you very much.
Thank you, Conseillère Plante. Do members have questions for the delegate? Okay, seeing none. Merci, Conseillère. Thank you for your work on this difficult issue in your community as well. Thank you. Okay, we'll go to the next delegate, which is Steve Ball.
Good evening, everyone. Can you hear me okay? Yes? Thank you, Councillor. Yeah, you summed it up beautifully for sure. So for those I haven't met, I'm the president of the Hotel Association. I'm a member of the Shepherds of Good Hope Board, but I also sit on the Byward Market Community Balance Task Force, which evolved from the Byward Market Mental Health Committee that was trying to address the mental health crisis, which was amplified by the pandemic. And so I don't want to repeat what Dr. Etch has reported earlier, but I think I'd like to focus on just 4 points. 1, to accomplish anything constructive, you need to get buy-in from the community you're trying to serve. And through the research we've done through the task force, we have engaged the unhoused community to learn what their issues are and how we can work together to make the precinct a better place to live, work, and for everyone involved. We asked the people what they needed to improve their living conditions, and they told us. In fact, not only did they share with us what was wrong with the current service provisions, they actually are providing us suggestions on what they can do to also help the living conditions for everyone. And some examples of the things they've told us are they want us to create opportunities for human connection. They want to support efforts to congregate. They want to support their efforts to bring back positive aspects of street culture and to respect their leaders. They want us to stop oppressing them. They want to stop doing things to us and try doing things with us. And finally, they want to support their efforts to be mentally and physically healthy. They know they need professional treatment and care, but they also want to be able to care for themselves. They need to be able to listen, to read, to listen to music, to play sports, have social events, and to do the same sort of things everyone else does to have a happy and a balanced life. So what does that mean? And Dr. Etchers referenced our block leadership program, where we've trained actually 76 block leaders to date to actually assist in the community with a community engagement and to work with the street level community to be better neighbors. Number two, we're focusing on a very few number of deliverables that can make big changes. Our early focus is on safe space, which also Dr. Etches referenced, training and skills development, and positive engagement. And although it's early, we're only into this a couple of months, we are seeing a marked improvement in the area, not only just for the people on the street, but also for the people living in the community. The third thing I would like to focus on is, you've heard the expression, it takes a village to raise a child. And the same thing applies to maintaining a balanced community. So the unhoused and those with mental issues, drug challenges are not going away. So we need to integrate this group into our community in a way that balances the playing field. Social disorder is a symptom of a feeling of mistreatment and unfairness. And the best way to remedy this is through inclusion and support for our less fortunate. And this is exactly why the hotel community and hospitality community is making an effort to try to engage in this area, and why we believe that it's an all of community requirement to be able to make the necessary changes we need to see real results. The last point I'd like to make is that the Byward Market Community Balance Task Force is an incredibly inexpensive approach to dealing with a problem on the street. It's not going to solve all the problems, and it's not going to address all of the different players that make up the culture in the Byward Market. But by engaging the people on the street, it helps to make their own space healthier and safer for themselves, and that's moving in the right direction. So what I would leave tonight with is just urging the city to continue to support this important program. We are developing data, and we believe that we will be able to demonstrate improvements, maybe small at the beginning, but we've got to start somewhere. And we also think that this model might be something we can replicate in other markets. Thank you very much for speaking to you tonight.
Thank you very much for your delegation. Do we have any questions? Member Bauer?
Thank you, Mr. Ball, for your work in the community on the task force and at the association. As a resident of Lower Town, just adjacent to the Byward Market, I've been aware of the initiatives in the hood, and I just have a quick question around the creation of safe spaces. I was wondering if you could provide the board with a tangible example of what that intervention looks like.
I can, and this is direct feedback from the street, is they just have nowhere to go. There's nowhere to go to the bathroom, there's nowhere to congregate, there's no place for people in that community to be able to gather. This is something, as I mentioned, I'm on the board of Shepherds, that 260 Murray is going to provide drop-in space. But if you've got nowhere to go, you've got nowhere to be, and so you just wander the streets. And this is part of the problem, as you can imagine, in any culture or any situation. If you've got nowhere to go, it just gives you no sense of purpose.
Thank you.
Thank you, Member Bauer. Do we have any other questions for the delegate? Okay, seeing none. Thank you, Mr. Ball. We'll go to our next speaker, Logan Martin.
Thank you. Can you guys hear me okay? Great. So thank you for the opportunity to speak. My name is Logan Martin. I'm with the Ottawa Paramedic Service, more specifically, our mental wellbeing response team. Each day, the Ottawa Paramedic Service responds to approximately 30 mental health related calls from 911. Many of these individuals are needlessly transported to a hospital when other care options may be more appropriate. On March 1st of 2022, in partnership with the Ottawa Hospital, the Ottawa Paramedic Service launched the Mental Wellbeing Response Team to provide individuals with appropriate mental health and substance use care in the community. The Mental Wellbeing Response Team is comprised of a specially trained paramedic and a mental health professional from the Ottawa Hospital, who together respond to non-violent, non-criminal 911 calls for service where mental health and substance use are contributing factors. The Mental Wellbeing Response Team operates under the Ministry of Health's approved treat and refer model of care. Through the Mental Wellbeing Response Team, individuals may receive a medical and mental health assessment from this interdisciplinary approach, as well as resource referrals and follow-up mental health care in the community when and where they need it the first time. This interdisciplinary response sees the marriage of medical and social services, provides system navigation, connection to community-based resources, and follow-up mental health and substance use support, while avoiding overcrowded and frenetic emergency departments and changing the overall patient experience. The average emergency department visit for mental health related complaints at the Ottawa Hospital in the 2022-2023 fiscal year was over 12 hours. After discharge from the emergency department, many of these individuals are referred into the mobile crisis team for follow-up assessment and short-term care 24 hours later. Individuals cared for through the Mental Wellbeing Response Team can now be assessed, cared for, and referred into resources as needed in just over 1 hour, compared to over 36 hours after being transported to hospital. In the first year and a half that the new team has been in operation, they've responded to multiple calls each day. Of these, 70% have not required transportation to hospital. MWRT, or our Mental Wellbeing Response Team, has demonstrated overall success with the mental health population. However, the worsening death toll mandates additional strategies for ensuring specialized care is available for all people living with substance use, health, and concurrent disorders in the City of Ottawa. The substance use population continues to be underserved with significant and unique barriers to accessing equitable care. Opioid use disorder impacts people from a large cross-sectional swath of society. However, many people with this condition are marginalized, feel stigmatized, and rarely see healthcare providers. This leaves a significant number of patients with this deadly condition underexposed to effective and life-saving treatment options. The acute opioid overdose that triggers a 911 call can afford a rare moment of exposure to a healthcare provider who can provide referral and treatment options. This should be seen not only as an opportunity to reverse an opioid overdose and save a life in that moment, but also as an opportunity to introduce the patient to treatment options available for their condition. Given the current potency and unpredictability of the street supply of drugs, this opportunity may be the last that this person ever gets. In February of 2023, the Ottawa Paramedic Service embarked upon a new mission to improve substance use care and pathways for its 911 clients. Through supportive and collaborative partnership with the Ottawa Hospital, the Regional Paramedic Program for Eastern Ontario, the Royal Ottawa Mental Health Centre, Recovery Care, and Ottawa Public Health, the Mental Wellbeing Response Team will soon introduce an addendum to its current model of care. This addendum will see the Mental Wellbeing Response Team further equipped to provide compassionate, patient-centered care to individuals experiencing challenges with substances, including opiates. Mental Wellbeing Response Team paramedics will soon be equipped to initiate Suboxone, an opiate agonist medication which alleviates the symptoms associated with severe and painful opiate withdrawal, often secondary to naloxone administration in the community. Through collaborative community partnerships, individuals will be provided with pathway opportunities that meet them where they are at in their journey. For the first time in Canada, 911 patients experiencing signs and symptoms consistent with substance use may receive symptom management from paramedics and a direct referral into rapid access addictions medicine clinics through the Royal Ottawa Mental Health Centre for follow-up in less than 24 hours. A direct transfer of care and warm handoff to either the Royal Ottawa Mental Health Centre's Rapid Access Addiction Medicine Clinic or Recovery Care's Rapid Access Addiction Medicine Clinic. Direct referrals into Ottawa Public Health's Harm Reduction Team and or a 24-hour follow-up by the Ottawa Hospital's Mobile Crisis Team for individuals not wanting to commit to a defined care pathway. The Ottawa Paramedic Service is continuing to work with Ottawa Public Health in the development of these pathways to ensure inclusion and consideration of our most vulnerable and unhoused populations. Thank you.
Thank you very much, Logan. Do you have any questions for the delegate? Member King?
Thank you so much for your delegation and for really outlining the incredible work that the paramedic service is undertaking. I was just interested in seeking a little bit of data. I was just curious if you do have the number of the direct referrals that have been made to pathways for patients.
Thank you, Councillor King. So we do, off the top of my hand, I don't, but we do track. We do have data tracking, which does show not only the amount of individuals who have been resourced into community resources, but also all of the different resources where these individuals are going to. And that's something that we would be able to provide in partnership with the Ottawa Hospital, recognizing that their mental health professionals are typically the individuals that are doing the referrals.
No, I appreciate the potential of being furnished that information. I think it's important to measure in order to manage, but the key element here is that we have a better framework in terms of engagement with patients and ensuring that they do have pathways to care. So I appreciate the work that's being undertaken, and thank you. And I'm sure we might hear reports about this as well at Emergency Protective Services Committee. Thank you for your delegation.
Thank you, Member King. Seeing no other questions, we'll go to the next delegate. Thank you very much. Next on our list is Sarah Taylor.
Thank you, Councillor, and thank you, Board, for having me this evening. I'm here to talk about, similar to how Dr. Etches, and then really in follow-up, Councillor Carr, to your motion, the great partnerships that Ottawa Public Health continues to provide to the city's Community Safety and Wellbeing Plan. So I'm the Acting Director of Community Safety, Wellbeing Policy and Analytics within the Community and Social Services Department. In 2018, the province of Ontario passed the Safer Ontario Act, which requires all municipalities to have a community safety and wellbeing plan. And the framework of the plan is embedded in a social determinants of health approach, meaning that the plan should focus on prevention activities within a in the space of social determinants of health and social development. So as a community, we can focus and prioritize on the complex issues where we can see long-term achievement and growth over time for individuals in our entire community. So in 2021, City Council adopted the city's first community safety wellbeing plan with 6 priorities, which are discrimination, marginalization, racism, poverty reduction and financial security, gender-based violence and violence against women, mental well-being, and integrated and simpler systems. In addition to that, the plan uses a collective impact framework, which at the basis of it means that the problems we're experiencing or as a society are growing more and more complex, and they aren't for one institution or organization to solve alone. But the theme you've been hearing throughout the opening remarks tonight is that we need to work collectively across community, institutions, organizations, and individuals to have an impact. And so all of the priorities start with that as a foundation, both from a prevention, social determinants of health, and collective impact space. And Ottawa Public Health has been a leader since the creation of the plan, with Dr. Etches sitting on the advisory committee that oversaw the development of the plan, with her continuing in a role as part of our advisory committee, and moving down to key areas where the Ottawa Public Health is contributing to progress, from food security to the mental well-being and substance use work, as well as with the team of epidemiologists who work closely with our data and analytics team and community and social services to bring forward an evidence and data-informed picture to a lot of the priorities that we're talking through tonight. And that partnership between Ottawa Public Health, Community and Social Services, as well as all of the community partners, the school board, police or others, are really critical to seeing progress in some of those areas. One of the key priorities that I mentioned is mental well-being, which has two outcomes that we're striving towards around improving access to mental well-being and substance use supports and services, which I know the following delegation, the members of the guiding council will talk about the work that's been completed around an alternate response for mental health and substance use crisis, which Ottawa Public Health and Community and Social Services and paramedics just from Logan have been participating on. And then as well as promoting a mental well-being in a stigma-free environment. And they continue to partner, and we work together along with community partners to really build on the existing work that was happening in the community, but to drive change through an integrated systems change approach. And so we're grateful for the partnership and the ongoing partnership that we really see value in and have seen results to date, but will continue near into the future. Thank you.
Thank you, Sarah. Do we have any questions for the delegate? Seeing none, thank you very much for your delegation. We'll move on to the next. We've got Liz Wigfall and Sahada Alolo. I believe you'll be delegating together, so you have 5 minutes. Oh, we need Sahada to accept the prompt to be promoted to panelist. Okay, perfect. Go ahead, thank you.
Hey, good evening, everyone. Bonsoir, tous et à toutes. My name's Liz Wigfall, and I'm the co-director of Ottawa Guiding Council for Mental Health and Addiction Secretariat, along with Sahada Alolo. And we're here to talk about the work that we've done as Secretariat and as a Guiding Council on an alternate, safer response in crisis for mental health and substance use in Ottawa. So we started as a Guiding Council in January 2021, and there were several members of the council, including Ottawa Public Health and the City of Ottawa, paramedics, and also the Ottawa Police Service, as well as several community networks who've been working together, who work in the mental health and substance use field, hospitals, settlement sector is there, and child and youth mental health sector, amongst others. And this group of people have been very committed to working towards making a new, safer response for people who are in crisis. The Secretariat has been together since March 2022, and during that time, since then, we spent the first year working on some research pieces, including consultations with the community and with service providers, also with faith leaders and academics. So we did consultations, which included surveys and mostly focus groups in person and online, and one-on-one interviews. We did a mapping workshop with a reference group of people with lived and living experience. There are 11 members of that. And we asked people where they were going during a crisis and what they would like to see as a result of that. So we were able to connect with almost 1,200 people, which was quite a lot. And from that, those consultations, we learned quite a bit and were able to put together some recommendations. And one of the main ones was to make sure that we center racial equity in mental health and substance use crisis response, as people who are Black, racialized, and Indigenous are more likely to have a negative experience as a result. So that was one of our main recommendations. Another one was increasing collaboration, so the work is not siloed. And as a result, the Guiding Council has put together through an implementation working group a prototype that is going to be starting and launched in July 2024. So this was the funding for this was passed by motion in July. So we're very grateful to the City Council for passing that motion, and we will be funded for the next 3 years. And we're looking at looking at one location, and in that location there will be 24/7 multidisciplinary mobile crisis response. Meaning there'll be peer support workers and mental health professional responding, so a civilian response, and looking at a no wrong door approach, because many people do not want to call 911, but they would be more willing to call a different number or 211. But having this no wrong door approach, they should still be able to connect through 911. And people on this call, Sarah and Logan, have been very helpful and looking into that in more detail. So the prototype location is still being considered, but we should have news for everybody very soon in the coming weeks. And also a request for proposals will be launched, and to give organizations in that location the opportunity to come on as partners and to really take on the work for this. So, and you can see our strategy and our report on our website, which is at ottawagcmha.ca. So check it out if you haven't already. And yeah, so I'd like to see if there are any questions, and Sahada will answer the questions. Thank you.
You're right on time. Thank you, Liz. Do we have any questions for the delegates? Seeing none, thank you both. Okay, next we have Sylvie Bigras.
Hi there, sorry about that. I hope that you can see me okay. Merci beaucoup pour votre invitation. Merci, Madame la Présidente. Je vais faire ma présentation en anglais, mais évidemment, si vous avez des questions en français, ça va me faire plaisir de répondre. I am the volunteer president of the Lowertown Community Association. I'm also a resident of Lowertown, very near the Byron Market for 42 years now, living in this little house and loving my community and wanting to help my community. I just want to start by saying that we at the LCA feel very hopeful. We've had so many great meetings, collaborations, discussions, brainstorming sessions with so many people, some of you on this call or on this meeting. And so we feel that there's lots going on, but we think that the needle needs to be pushed much, much further. You've heard from a few delegates about the crisis that we are living. You know, it was declared in 2017, but it's worse now. People are dying every day. We have people taking their dogs to a dog park and dying because they've ingested a substance on the ground. We have school children afraid to walk to school. We have bars on windows. We have people afraid to walk outside, etc. It is truly a crisis situation. Radio-Canada and many media have covered, I think Councillor Plante mentioned that they compare it to the Lower East Side of Vancouver. So what do we do? What do we need to do? I love Councillor Carr's motion where you talk about coordinated and interconnected strategies and action plan. That is big in my notes that I have for you tonight, as well as Sarah Taylor saying we need to work collectively. What we have found in our observations over the last decades is that there are many people who are intervenant, providers, etc., but a lot of people working on their own in silos and not collectively. So I'm really very reassured to hear that this is part of the strategy. What we recommend very strongly is that the OPH have take a lead on an action plan flowing from strategies of people who understand this area and who can create the action plan that will help. The first thing is We call it a room of my own. The unhoused people we deal with, some of are on our committees, they come to our presentations. They were at a community meeting last week. They said, all I want, Sylvie, is a little room with a door that locks. They're not looking for new, not looking for luxury, not looking for big, not looking for a garage. They just want a room of their own. And we don't need something new. Therefore, I'm asking all of the councillors who are on this call to speak with your fellow councillors, roll up your sleeves and say, what do we have in our ward that would actually provide a room that's clean and safe? It can be old. My house is 150 years old. I keep it clean. I love it. You know, we could look at convents. We could look at schools that have closed. The building at Kilbourne and Bank is a great initiative. We were thrilled to hear about this. And so let's all roll up our sleeves, because we need to deconcentrate the services and the housing from Lower Town, Sandy Hill, Ballard Market, Vanier, and actually all 24 wards of the city need to take responsibility and share the care of those who are vulnerable and who are suffering. And there is no question that they are definitely suffering. So small scale housing throughout the 24 wards with support services. We cannot continue to have mega shelters. They are overwhelmed. And as the councillor or someone said, that the predators are around there, traffickers, criminals, et cetera, et cetera. And so we really need to do something differently. So if we were able to provide some small scale housing in all of their 24 wards, we would help people where they fall. There is a myth that people need services here. No, you know, a child was transported, not a child, a young man was transported from Fitzroy Harbor to George Street for mental health treatment. Come on, you know, we need to help people where they fall. People have mental health issues, they lose their jobs, they lose their home. They are drug addicted in all 24 wards of the city. Small scale housing with some services. These are the solutions that we are proposing, and we certainly are happy to to do what we can as a community currently housing many vulnerable citizens to continue the dialogue and the conversation. And so I will say thank you very much for your few minutes today, and I'm happy to take some questions. Merci beaucoup. Ça me fait plaisir d'être ici avec vous.
Merci beaucoup.
That was my timer.
Do we have any questions for the delegate? Go ahead, Member Bauer.
Merci Sylvie pour ta présentation. As a frequent attendee of LCA meetings over the past couple of decades, I've been very impressed by the collaboration of the mental health outreach workers from the various social service agencies that have come to present to the Community Association, as well as the Ottawa Police Service, who is, of course, a regular member of each meeting. And so I'm just wondering of your perception as chair and observing more recent meetings, sort of if there are, greater avenues for cooperation, collaboration between OPS and the mental health service outreach services that seem to be emerging more robustly in recent years.
Well, certainly Constable LeMay and Constable Paul Stam are at almost all of our meetings, and we have regular meetings with them as well. And so they are incredibly engaged. They actually support our 24 and 24 small scale outside of the core 100%. They are talking to other police services throughout Canada and even some models in the US, and they say to us, what you were recommending is actually the way we need to go. And I love hearing about the statistics of the alternative responses for mental health, which they also support, which we support as a community. And I also want to say that, we as a community, we actually care. And I want to say we know the unhoused by name, by face. At our last meeting, we distributed naloxone kits. We actually check on people when they're bent over to make sure they're breathing, because we live here 24/7. So we care, we want to help. The current system is not helping because we're cramming them all into a small area, and they feel unsafe. They say, I'd rather sleep in the park, Sylvie, than in a shelter where I have to keep my shoes on because they get stolen, and sleep on my little backpack because otherwise that gets stolen too. So, the collaboration with the Ottawa Police Service has been tremendous. but we need to change the way that the system is kind of working right now. Thank you very much.
Merci encore.
Not seeing any other hands up. Alors, merci beaucoup, Madame Bigra, pour votre délégation. Thank you. Next, we have Calla Barnett and Louise Lapointe, who I believe will be delegating together. So you have 5 minutes.
Hey, merci, bonsoir. Mon nom est Louise Lapointe. Merci de nous recevoir. Et Calla Barnett, je suis la présidente de l'Association communautaire de la Côte-de-Sable. I'm chair of the Action Sandy Hill, the Community Association for Sandy Hill. So Dr. Etches forgot a very important group and those that should be included in her task force and in all of those groups. It is the residents and businesses who live where the services are located. So interestingly enough, it is quite telling that the Community Wellbeing and Safety Plan does not include anyone representing residents or business interest in Sandy Hill either. However, the CT has often reported how bad the situation is around Bestford. It's a little ironic that the opening comments related to the importance of community health and well-being policies that were aimed to address the opioid crisis have created a toxic environment for residents and businesses, the unhoused, and for people who use drugs in the Sandy Hill North sector. Yet, no one from Sandy Hill, at least of all residents, have been approached, invited, or consulted for this strategy. I guess community does not include the families that are living on Bestford and daily. Residents, business owners, and their employees, drug users, and unhoused persons have been attacked and robbed. This toxic environment is the result of policies that allow for services to be concentrated in a small area. Services for illicit drug users were added in an area concentrating services for unhoused, and this has translated an increased presence of drug dealers and violence that often accompanies them. I'd like to remind you all that the young children in social housing block away from these drug services are confronted daily with violence and witness drug use. The public library that serves our area is a block, not even a block, is right across the street, and children witness this on a daily basis. I don't think that normalized drug use is a social determinant of health for children, especially not poor children or rich children. It doesn't really matter. Any child should not have to see this. This is not a question of stigma, by the way. When I see there's a difference between stigma and normalizing a behavior. When it is not normal, no longer considered normal to smoke a cigarette outside a door, I find it quite interesting that we're now saying that it is normal for people to inject or smoke meth or fentanyl at the door of the Byward Clinic. We, families, seniors, students, visitors, businesses, kids, witness open drug use, overdoses, violence on comatose drug users on a daily basis. I wish I were exaggerating. Unfortunately, I'm not. At a time when there is so much talk about housing, we live in an area where we're no longer safe in our homes or on our street. Action Sandy Hill took a recent poll of residents, and 63%, a third, don't feel safe anymore walking around. So this has been made possible due to a lack of leadership on the part of the City of Ottawa, obviously, and Ottawa Public Health, and organizations are operating without proper oversight. I'll skip you the rest of it because I think people have spoken to this already. I want to point, before I hand it over to Calla to talk about what we've been doing locally as well, I just want to point out something about the CTS guidelines. They do provide for only 15 meters outside the door, and we have asked Minister Jones, the Minister of Health of Ontario, to consider integrating the requirement of a good neighbor policy or good neighbor commitment to ensure that service providers are held accountable and responsible to address all of the problems that are resulting from inviting drug users to a community, inviting drug dealers to a community, because the drug users have to buy their drugs, and their drugs are being bought on our front porch. They shoot up on our front porches and on our steps. And it's pretty sad when you have a neighbor telling you that they've been hit over the head with a pipe, asking someone to not to do that because they were blocking their front doors. Anyway, I'm rambling on. I'm going to hand it over to Calla right now to to speak about some of
Please, I'm really grateful to be here today. I do want to talk about the community-based solutions that we've been putting into place because there has been no overt response from the city, with the exception, of course, of the CET team. OPH has ignored us until this summer. And until there was Stephanie Plante, we were ignored by our counselors. So we have not gotten any responses into our, we've been brushed off as NIMBYs. I'm sure you've all heard that term. But our concerns are not NIMBY concerns. My concern is that people are dying in the streets. That is my concern. My concern is that it's not safe for them. It's not safe for me. It's not safe for my child. My concern is the daycare. One of 2 daycares in Sandy Hill that has now had to pause service because it is so toxic in their area. My concern is that until 6 months ago, service providers in the area wouldn't even speak with us because they told us that we just needed to be educated. So now that service providers are actually speaking to us, we have created our own liaison committee among community stakeholders, including unhoused and housed residents, businesses, service providers, and other, including like the library that closed daycare, other people impacted by the effects of the toxic drug supply in Sandy Hill, in order to come up with solutions that will help us in our community because nobody else seems to want to. So that's what we are doing. We were not invited to whatever Shepherds of Good Hope and OICH are doing with their block captains. That's wonderful. I'm really glad. But it's the Sandy Hill Community Health Center in the last 6 months that stood up for Sandy Hill and redirected their budget to create community people who go out on call to support our residents. I understand that I'm almost out of time.
Yeah.
I want you to know that we are coming to you with community-based solutions. OPH is actually on that. We actually finally have a rep of OPH on our community liaison committee. I'm not sure why that wasn't mentioned in the report. So these things are important. We need to be included in Sandy Hill as much as Lower Town and as much as Vanier. Thank you.
Thank you very much. Do we have any questions? Seeing none, thank you both for your delegation this evening. We're about to go over 7 o'clock, so I'll just ask Member Bauer if you could read the motion to extend, and then we have one more delegation.
Thank you, Chair. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Is that carried? Thank you, everyone. Okay, our final delegation, Wendy Stewart.
You guys must be exhausted. So I'll make it really quick. And how do I follow all of this? So bonjour tout le monde. My name is Wendy Stewart. I am the director of the OASIS program, which houses the CTS at the Sandy Hill Community Health Center. We have a new executive director, Robin McAndrew, and I joined 6 months ago. And I don't have a script, guys. I'm speaking true to the heart. I was out this afternoon doing outreach services and support, so I don't have anything written. I will say that when I came here 6 months ago, I was astounded at the state of many things, including community relations, the state of what we saw in the community, you know, people who were experiencing homelessness and experiencing the toxic drug supply, expressing the need for help, those that are residents, businesses. So, you know, and I'll tell you, as an agency, we kind of took that, we became a bit of a lightning bolt in terms, or lightning rod in terms of all of that anger. And at the end of the day, you know what, our philosophy is let's lean in. So hearing all of these initiatives, hearing all of, you know, what committees are already existing, I do encourage that, you know, CHCs be part of these conversations. Just to highlight alone, when we talk about engagement of those that are experiencing homelessness and using the toxic drug supply, last year we had over 14,000 visits at our center, over, you know, 785 regular clients seen at our clinic. 2/3 of those are receiving services of our primary care clinic for complex urban health issues, including our RAM and our OAT clinic, our opioid agonist program as well. So we are significantly engaged with those that are directly impacted by this, situation right now, but we're also, noticing that, not noticing, it's in our face, all of us, that beyond the 15 meters for which I am funded for, and that is the mandate, we have had to respond. So, within the context of our current funding agreement, we've even maxed out our extensions of our security services to go down further along Besserer. We've also taken internal resources as well within our CTS and build in our already taxed staff. We've added an additional service onto their day where they're doing outreach when operationally feasible. So we've had to pivot as an agency. We are hearing folks, we have significant limitations in terms of our own mandate, but seeing and hearing what we're hearing, as an agency, we really look forward to being a real collective part of not only what Action Sandy Hill would like, our counselor, all of you sitting here at this table, OPH. We look forward to being, a real interactive community agency in terms of that multi-sectoral approach. We do believe that we have a lot of expertise here. We clearly are, engaged with the localized community. And I think in terms of that good neighbor approach, I couldn't agree more. But to do that, we need to lean in and all of us work together to, collaborate on current resources. How do we maximize that? But are there opportunities for us to come together and seek other services to help better support broader harm reduction services in the community? So from a small kind of localized approach, Sandy Hill Community Health Center and specifically the OASIS program is really pleased to have been invited here today just to say hello, get our name, a name and a face connected to everybody. But to also thank all of you here for allowing us to have this space. As you hear, there's much frustration amongst everyone, and it's time to everyone lean in. We are all listening. We are all in agreement that different approaches are at play, and certainly within this Sandy Hill Community Liaison Committee, bringing together, as you can see, very strong opinions, people who have lots of lived trauma, not just those that are using the direct services and experiencing homelessness, but those that are residents and businesses in the area. And so through that collective trauma-informed lens, how do we bring those voices together to enact on short and longer term solutions that have all been brought up here? So again, merci, miigwech, and we really do appreciate your time today. Thank you.
Thank you, Wendy. Do we have any questions for the delegation? Okay, seeing none, thank you very much. And thank you to all delegates for coming today to share your passion and your perspectives and engaging with us on this very important and difficult issue. So a big thank you to everybody who came out tonight. We will move on now to questions from members to Dr. Etches, or you can also comment or ask questions about the motion at the same time. If you want to just raise your hands, I'll go in order. Member Brown-Treves.
Thank you, Chair Kitts. Thank you, Dr. Etches, for that very informative report. As it relates to substance use and harm reduction, I was wondering if primary care is a partner in the strategy. We do need all hands on deck, and I didn't see any primary care organizations listed in the partner list. And secondly, I believe the crisis will only get worse without a primary prevention strategy. Prevention is probably the first step to addressing overdose, and I was wondering if you could speak to primary prevention on the issue as well.
Yes, absolutely. There's There's a role for primary care, an important one. We do see primary care as the foundation for our healthcare system. Unfortunately, we see that it's a bit shaky right now in terms of 15+% of our population not having access to primary care. And in particular, we had a lot of discussion about the Byward Market and area today, and it's actually really most of the population has not got access to primary care. So that is part of what we would like to work with our healthcare providers to address, and we are, in conversations about who could help. More broadly across the city, we do communicate with primary care providers about the data we have, the risks we're seeing, what people could be aware of, and I think we have room to continue to support their work on early childhood. There's lots of things we can further explore. Certainly, I spoke a little bit about primary prevention today around the avoiding adverse events in childhood. Ensuring people have a home is also, there are many determinants there where, again, the levers are usually outside of public health, but we can use our data to point to them to try to mobilize collective action. I'm not sure if anyone else, who's working in this area from Ottawa Public Health wants to comment on our work with primary care, but we certainly see that prescribing, well, first of all, diagnosing substance use disorder, well, even before that, asking about substance use does not routinely happen in primary care. So starting with asking about substance use, figuring out if it's a disorder, prescribing treatment can be done in a primary care setting, and we know there's so many demands on primary care providers' time that just isn't routine practice always where it could be. So we're thinking about, again, how do we work with leaders in primary care, help them have the supports they need to be able to do more to address substance use and get people linked to treatment. But there are many primary care providers working very hard, and they'll also tell you there isn't anywhere to refer or get support if they need it. So, there's multiple layers here where, I think the healthcare system ideally would be more integrated and would have more options for people.
Did you have additional questions, Member Brown-Travis, or you're good?
Oh, no, that's good. Thanks.
Thank you very much. Member King.
Thank you, Chair, and I just wanted to thank the work of Member Carr on this motion. It's obvious with the amount of challenges that we're seeing in our communities and the criticality of those challenges that it's important for us to have an update in terms of a comprehensive multi-sector overdose response strategy. We know from the last term that there had been a tremendous amount of work actually undertaken by Ottawa Public Health. In 2019, the establishment of the Ottawa Community Action Plan, ensuring that there was a comprehensive substance use strategy undertaken, with an emphasis and findings that are becoming more crystallized even today in terms of addressing education, in terms of really going into communities and addressing these challenges. So I think it's important to acknowledge the work that had been undertaken, the fact that many community members came together in a symposium at that time to really launch the objectives of a strategy, and that unfortunately that strategy needs to really be funded. And so I think that that's one of the key elements that we really need to look at. And so my question for Dr. Etches really just focuses on the federal investments and what we're seeing from those federal investments. We know that in the 2023 federal budget, there was a tremendous amount of money that was announced to really address public health and opioids specifically. So I'm wondering if you can talk to some of the resources that have entered our community or that might be pending into our community from senior levels of government.
I'm not personally aware of any federally funded projects other than the Safer Supply pilot and evaluation that's underway, which has some preliminary results that are promising in terms of people who are in the program are finding that they're able to stabilize, participate in less crime, reconnect with family, find employment. Some of these outcomes are promising. Kira, do you know of any other federal dollars coming? I think broadly, I would say the federal investment in housing solutions is probably a big dollar item that our city needs. And so again, it's not my area of expertise, but if we're going to increase the amount of supportive housing that's available, it's likely going to require funding from all levels of government.
Thank you so much for that. I think that we did hear that from the delegates, that one of the key elements that will allow people to become more healthy is if they have a key in hand and a permanent place to live, to ensure that there's stability in their lives so that they can be more receptive to substance abuse treatment. So it's important for us to see these dollars enter into our municipality. I think that there has been a lack of dollars around housing, specifically supportive housing and social housing. You know, I think some of the discussions that we've heard in other places at around the council table, you know, provincially has been focused on market solutions. But it's evident to us that we need to ensure that we are looking at non-market housing solutions in conjunction with our public health initiatives. So I really appreciate those items, that those responses. I think that they're reflective of the work that OPH has undertaken over the last 4.5 years. And obviously there's much more work that needs to be undertaken both by public health and all stakeholders to really ensure that we are addressing this crisis effectively. And I think a major component of that, of course, is ensuring that we see real investments from senior levels of government in housing and also in our public health infrastructure. So thank you so much once again to Member Carr for moving the motion. I will wholeheartedly support this, and we understand the concerns in the community because we're seeing things getting worse, not better. We need to go in the opposite direction. Thank you, Chair.
Thank you very much, Member King. Member Gower, please.
Thank you. No questions, but a comment. I was actually speaking with Councillor Plante last week that 2 weeks ago, I had 2 residents in Stittsville contact my office to see if I was aware of the homeless issues and the substance abuse issues downtown. And my first thought was, am I aware? Of course I'm aware. It's all we talk about at City Hall these days. But it was a reminder to me that I think sometimes those of us who are in this business, so to speak, we are in a bit of a bubble. And I think there is a real lack of awareness of why these problems exist, what various levels of governments and agencies are doing to address it. And so I want to thank Councillor Carr for raising this, bringing this motion forward, and everyone who worked on it. I think the first line in here, increasing public awareness and understanding of the work that is underway, is incredibly important. Increasing awareness, increasing empathy, and I think also it will help help everyone. The more that people are aware, the more that people have that empathy, the more that we can effectively advocate for the support from other partners at other levels of government and elsewhere to make sure we have the resources we need to address the problem. And if anyone is tuned in tonight, it's been a long meeting. We are very aware of the issues we're facing and very focused on finding solutions. So thanks to all the delegations who presented today as well. Thanks, Chair.
Thank you, Member Gower. Appreciate those comments. Member Carr.
Hi, thanks very much. Interesting, as I was listening to the delegations, we heard a lot from the core, from people that were living in Sandy Hill and in the market. One thing that I found really interesting and which was really enlightening to me, and hearing you, Councillor Gower, speak about people asking about the downtown, is that I was really surprised as a member of the police board when they were presenting statistics on the overdoses that they were dealing with. And I asked, are these geographically concentrated? And in the downtown core? And the answer was no. These are all over the city. So we oftentimes will see people out on the street using an open air in the downtown core, but it really drove home as I dug more in the statistics, and part of the reason why I was talking to Chair Kitts about the need for that data when I've looked at other cities to see that they've got some attempt to geographically distribute it. To me, that was really, really eye-opening, because I often think of it as, you know, a downtown problem, but when I dug a little bit deeper, it really is a citywide issue. And I think that that's one of the reasons that I think the data is so important to inform on where services are needed and inform what's really going on in our community. But I just wanted to add that. Thank you. And I'll just consider that to be wrap up, just as my final comment. But yeah, and thank you to Chair Kitts and Dr. Etches for all your support.
Wonderful. I don't see any more hands up. So again, I do want to thank all the delegates that came out to speak today, the diversity of partners that are engaged on tackling this crisis that, as Councillor Carr just said and delegation said, is affecting the entire city and really the entire country. And on a personal note, I want to thank Conseil Plante for the meaningful conversations that we've had recently. I know the team at OPH is committed to enhancing efforts and innovations and working with the community on solutions. So is the motion from Member Carr carried? And can we receive the Medical Officers of Health verbal report? Great, thank you everyone. So we'll move on to the next held item, which is, I've got item 7.3, Ottawa Public Health's 2023-2024 Respiratory Season Preparedness Plan. We have a presentation from staff, so I'll invite them to take their seats. We almost didn't have enough seats up there. Okay, take it away. Thank you.
Thank you. Bonsoir. I'm here this evening with my colleagues across OPH, including Jacqueline Wilmore, one of OPH's epidemiologists, Mary-Claude Turcotte, the manager of our immunization and stakeholder school partnerships team, Eric Leclerc from communications team, Laura Burns from our public health medicine unit, Michelle Wasser from our infection prevention and control team, and Denise Hébert from our emergency preparedness. I should have started by introducing myself. I'm Dominic Bremner, the environmental health branch manager with Ottawa Public Health. We are here today to present OPH's comprehensive preparedness and response strategies to the 2023-2024 respiratory season. I understand that this is a sizable team in front of you this evening, but OPH's response continues to be a collaborative endeavor with ongoing incorporation of lessons learned with teams across OPH actively involved. The following presentation outlines OPH's strategic approach to ensure the health and well-being of our community and our priority populations during the respiratory season. Through collaboration, preparedness, and evidence-based strategies, we aim to minimize the impact of respiratory illness and protect the health of our population, including ongoing work to prevent severe outcomes and lasting consequences from COVID-19 in Ottawa. Je tiens à remercier tous les employés de Santé publique Ottawa qui ont été et continuent d'être impliqués dans ce travail important. Great. 2023-2024 respiratory season is expected to be similar of last season, with early fall activity of seasonal respiratory viruses, including influenza A and B, and respiratory syncytial virus, better known as RSV, followed by a December peak in activity alongside the ongoing high burden of COVID-19 in Ottawa. COVID-19 activity has been increasing and is currently at high levels across multiple indicators, including outbreaks. Older adults are still at the highest risk of hospitalization and death from COVID-19. The impacts of influenza on children are anticipated to be higher than pre-pandemic seasons based on experience this year in the Southern Hemisphere, where the influenza season typically begins in April and is often predictive of the upcoming season in Canada. COVID-19 booster uptake is currently low for all ages, and rates of influenza vaccination are typically low among children. A key part of OPH's respiratory season preparedness and response strategy also includes mitigating health inequities. This includes working with Indigenous partners, community organizations, and leaders representing underserved populations, congregate care settings, as well as other high-risk congregate settings such as schools, shelters, and assisted living settings. Further, OPH's community engagement team continues to engage equity-deserving groups and communities that face the greatest systemic barriers for ongoing needs assessment. Implementing OPH's 2023-2024 respiratory season preparedness and response strategies are key to preventing, monitoring, and managing respiratory illness this coming season. Next slide. Current public health efforts in safeguarding the public's health during respiratory season include the incorporation of lessons learned from the pandemic and in response to identified community needs through the ongoing implementation of the following key strategies. I will now turn it over to my colleague Jacqueline Wilmore, one of OPH's epidemiologists, to review the strategies related to surveillance, modeling, and evidence.
Thanks, Tom. So local surveillance, modeling, and use of evidence supports prevention, detection, evaluation, and monitoring to inform the community and healthcare system responses. The updated respiratory and enteric surveillance dashboard, shown in part on this slide, provides weekly data and interpretation of respiratory virus activity to inform communications and prevention and mitigation measures. Age-specific data and longer-term trends found on the second page will be especially helpful in surveillance of respiratory illness in children and timely communication ahead of the curve. The dashboard is available at ottawapublichealth.ca/virus report and is updated on Wednesday afternoons. Our ongoing collaboration with partners such as local hospitals, the University of Ottawa, and neighboring public health units facilitates a regional approach to respiratory surveillance and infection prevention and control measures. We use local modeling of the upcoming season alongside provincial, national, and international data to orient public health efforts and support health system readiness. The Respiratory Transmission Risk Assessment for healthcare settings was developed in collaboration with local hospitals and neighboring health units. It was added to the dashboard on September 6th, as seen in the screenshot, to support our health system partners to adjust their IPAC measures using local epidemiology, in alignment with the Public Health Ontario recommendations released in the April report, Interim Infection Prevention and Control Measures based on respiratory virus transmission risk in healthcare settings. It is a simple and sensitive way to describe risk of respiratory illness to healthcare partners and prevent illness before the peak of the respiratory season. If 3 or more of the 4 indicators shown in the table are above low levels, then the assessment will show yes, Ottawa healthcare institutions are in a high-risk period for respiratory illness. Merci beaucoup. Maintenant, Marie-Claude Turcotte, gestionnaire d'immunisation, vous parle sur la stratégie d'immunisation.
Merci, Jacqueline. Since the release of the report, we have received more information about the new COVID vaccine as well as the new RSV vaccine. On September 12th, Health Canada authorized an updated COVID-19 vaccine, the Moderna XBB COVID vaccine for anyone 6 months and up. This updated formulation is expected to provide an improved immune response to currently circulating COVID-19 strains. We expect to receive initial doses in late September, which will be prioritized for high-risk populations, such as residents of long-term care facilities, retirement homes, seniors, individuals with chronic medical conditions, and pregnant people. And we are expecting that the vaccine will be available to the general population at the end of October. We are encouraging everyone to stay up to date on their COVID-19 booster and receive their annual flu shot to protect against influenza and COVID-19 this respiratory season. The influenza vaccine, similar to previous years, will also be prioritized for high-risk populations, beginning with long-term care homes and hospitals at the end of September, followed by high-risk residents such as young children, seniors, people with chronic health conditions, and healthcare workers. The general population can expect to receive their vaccine at the end of October. In terms of the RSV vaccine, Health Canada has approved the very first vaccine that helps protect against RSV. The vaccine is authorized for people 60 years of age and older. Ontario is rolling out its first publicly funded RSV vaccination program for those 60 years of age and older living in long-term care homes, elder care lodges, and some retirement homes. We are waiting for details from the Ministry of Health, including the specific vaccine recommendations, when it will be available, and exact eligibility criteria. There are many opportunities and options for getting the annual flu vaccine and COVID-19 booster this fall. Most pharmacies and some primary care providers offer them. We recommend individuals reach out to their primary care provider and local pharmacy to access the vaccines. OPH will complement the work of pharmacies and primary care providers with a focus on young children and people facing access barriers. COVID-19 and influenza vaccines will be available through the various OPH clinics. Through our community clinics, we will continue to run 3 community clinics 5 days a week. Through our neighborhood health and wellness hubs that are located in neighborhoods that are under-resourced. We will also host after-school clinics in priority neighborhoods to increase access, and run some clinic in rural areas to help support residents where there are limited options to access these immunizations. OPH has been working with long-term care, retirement home, and congregate living settings to build capacity, provide training and resources for immunizing their residents. To support the small number of long-term care home and retirement home that do not have access to healthcare workers, OPH has been working with healthcare agencies within Ottawa that will support immunizations. OPH will support a select number of congregate living settings that do not have healthcare workers or are not supported by a community healthcare provider. Finally, OPH will continue to provide COVID-19 and influenza immunizations to clients who are unable to leave their home to receive the immunization elsewhere. I would now like to introduce Éric Leclerc, who will talk about some of our communications approach.
Merci, Marie-Claude. Donc, bonsoir. Ce soir, je vais vous donner un petit survol de notre approche en ce qui a trait aux communications avec le public. Donc, je vais mentionner quelques détails. First, we started planning in the spring. One of the things we did is we reached out to 5 neighboring public health units across Eastern Ontario, inviting them to collaborate on our collective communications work. We also worked with partners, which include local hospitals, pharmacists, community organizations, such as those working with racialized populations. An important part is we shifted the focus from COVID-only prevention to respiratory viral illness prevention, adopting a refreshed, all-inclusive approach. Our focus is laid out in 3 phases, so there's prevention, mitigation, and recovery. We focused the messaging, of course, on the public at large, but this includes targeted messaging for audiences such as older adults, children, and people who are immunocompromised. We also adapted materials for diverse groups and communities to better reach our audiences, including First Nations, Métis, and Inuit people. Next slide. So here, there's obviously a whole bunch of tactics that that we have already started deploying, but we'll be doing so throughout the whole season. And I've got 2 examples here tonight. The first one is we created a modern-looking, easy-to-navigate web hub, and it's located at ottawapublichealth.ca/resvirus. Essentially, this is a one-stop shop for information and resources. In its current iteration, it includes the PDF handout for the public, important information on the various types of respiratory illnesses, prevention, treatment, and links to other helpful internal resources, including those from our partners. Notre contenu est disponible en 132 langues. That's right, 132 languages. And of course, we didn't translate 132 different languages, but we were able to offer it seamlessly through the Google Translate feature, which we embedded not just at this particular hub, but throughout our whole website. And it's quite effective, quite accurate as well. The respiratory web hub will be updated throughout the season as new materials are published and new details need to be added. So it's going to be a work in progress as we move through the motions. Le deuxième exemple, et vous en avez une copie dans votre paquet que vous avez reçu en format papier en avant de vous. This second example is the About Respiratory Illness handout. It is one of the products that actually came out of the collaboration with our neighboring health units. And the objective here is to better align our messaging across our greater region. For this handout and other types of messaging, we consulted with older adults, parents, and many community groups. We are adapting this handout for our First Nation, Inuit, and Métis partners, as well as creating multilingual versions that we will use at our neighborhood hubs and offer to many community partners. Maintenant, j'ai le plaisir de vous introduire la Dr. Laura Borns, Associate Medical Officer of Health, who will speak to you about testing and treatment. Laura?
Thank you, Eric. Provincial self-isolation guidance for the general population has shifted from COVID-19 specific and test-based to guidance based on symptoms. With this shift, communications to the public regarding testing have a focus on testing for those at higher risk of severe outcomes who may be eligible for treatment with antivirals such as Paxlovid. Ottawa Public Health continues to support access to COVID-19 testing by making rapid antigen tests available at a number of locations in Ottawa, including at Ottawa Public Health's clinical services, neighborhood health and wellness hubs, and through partners such as libraries and some community and social services locations. We will also begin distributing masks through these locations. Sites have been selected with the focus on ensuring residents who need tests can access them, including in rural areas. Ottawa Public Health has a tool on our website, as you can see here, which maps pickup locations for rapid antigen test kits. The provincial government is also making rapid tests available to primary care providers, hospitals, pharmacies, and other healthcare providers to distribute to their patients. For those needing Paxlovid, it can be prescribed by pharmacists, physicians, or nurse practitioners. We've seen healthcare settings ramp up masking in patient care areas as we enter the respiratory illness season. It's important for residents of Ottawa to consider wearing a mask to protect themselves, to protect those at higher risk of severe illness, or when they are recovering from respiratory illness. Distribution of masks will be rolling out through our rapid antigen test distribution sites in the weeks to come to help increase access to masks for the public. I will now Michelle Wasser, Program Manager of the Infection Prevention and Control Program with Ottawa Public Health, will now discuss infection prevention and control and outbreak management strategies.
Thank you. The Infection Prevention and Control team at OPH supports long-term care homes, retirement homes, congregate living settings, schools, and childcare settings with prevention, detection, and timely management of outbreaks of infectious diseases. Ministry guidance changes have now led to institution-specific infection prevention and control measures and personal protective equipment for risk mitigation. Furthermore, ongoing challenges persist in congregate living settings, long-term care retirement homes that include things like high staffing turnover and low staff resourcing, lack of infection and prevention control expertise, concern for institutionalized residents' quality of life, capacity issues for immunization, and adequate isolation for those experiencing homelessness. The Infection Prevention and Control team engages with multiple community partners, including Indigenous childcare partners, shelters, and group homes, to support diverse client needs and foster relationships for ongoing support. We regularly collaborate and advocate with Home Community Care Shared Services, Retirement Home Regulation Authority, the Regional Infection Prevention and Control Hub through the Ottawa Hospital, community paramedics, and the Ministry of Long-Term Care. The Infection Control team is supporting respiratory season preparedness this fall by providing webinars, on-site visits, outbreak support for our settings, while managing the current increase in respiratory outbreaks across Ottawa currently. I'll now introduce Denise Hébert, the Program Manager for the Emergency Management team, with an update on our emergency preparedness.
Bonsoir. OPH continues to use an emergency management approach to preparedness and applies lessons learned from one season to the next in its planning. In 2022, a third-party review was completed by Dr. Paul Gully to evaluate OPH's response to the COVID-19 pandemic. Recommendations such as those from Dr. Gully's report are embedded into our work to adapt and enhance our preparedness for future events of public health significance. As well, we review the OPH Respiratory Infectious Disease Response Plan and work with the community to raise the awareness about the importance of social connectedness to support our households and our neighbors. Most recently, OPH hosted an exercise with over 20 local partners to bolster system and community level readiness for the upcoming respiratory season. This exercise led to the greater understanding of pressures and roles and responsibilities of Ottawa Public Health and community partners in effectively engaging priority populations. It also highlighted the strengths of our relationships. Dominique Bremner will now address our next steps.
Thank you. OPH will continue to prepare for the 2023-2024 respiratory season, ensuring equitable access to vaccines and timely important multilingual information related to respiratory illnesses, and will continuously evaluate the delivery of its programs. OPH will also continue to work with internal and external partners to advance the plan, our response, and strengthen services during the current and future respiratory season. Thank you for your time this evening, and we are open to taking questions.
Great, thanks everybody for the update and the presentation. If members have questions, you can just raise your hand. Vice Chair Giovanni, go ahead.
Just getting my electronic hand up there. Well, thank you. This is a phenomenal amount of work, and I love how we've just built and built over the years, lessons learned and what can we do better for the next season, because we know that there'll be this season and then there'll be next season and we'll do even better. So thank you. The forecasting and the epidemiology models are just so valued in the community, and it's hard to even remember what it was like when we weren't doing all the testing and the modeling that we are now. So I just can't stress how valuable that is, so thank you. I did have two questions, and so one, if I understood it correctly, the vaccine availability, so we're all anxiously awaiting that, and we think it's sort of towards the end of September. If I understood it correctly, though, for high-risk areas, so for healthcare workers, that we'd be having early access to flu, which would be our norm, along with the high-risk populations, but not necessarily to the new COVID vaccine at the same time. Did I interpret that correctly?
Well, we're still waiting for details from the Ministry of Health around the specific rollout of the new COVID vaccine, but we are expecting the vaccine to be rolled out with priority population, same as influenza. So I can't speak to very specific groups, but we are expecting late September to get our first probably smaller amount of the vaccine, and as we get more vaccines, then the eligibility will be expanded to more groups.
Fair, thanks. Yeah, and so I mean, it'll depend on the flow of the vaccine. I know, the early healthcare workers tend to be early adopters of the flu vaccine, and then that creates a bit of a buzz with their families as well to be prompting vaccines. So if there's a way to roll them both out, I'd really be supportive of that. The next question was really around how we can best support primary care in making sure that they have the ability to see patients with colds and coughs and fevers, because what we did see in previous respiratory seasons since COVID is that we have a problem with access to primary care generally, but certainly, we were hearing from families that as soon as there was any respiratory symptoms, that they weren't able to go into offices. And so I see a lot of great work for infection prevention control support for long-term care and making sure that those regional hubs are up and running, but wondered if there was also sort of IPAC support or information for primary care that, in fairness, are working with their staff to make sure that they're feeling comfortable with having patients with respiratory, like febrile respiratory illness, come in and be seen in primary care when that's needed.
Through the chair, thank you for the question. You raised some very important concerns here and points here around capacity during the fall respiratory season. One of the things that Ottawa Public Health has been doing is working closely with our hospital partners, including CHEO, to provide communications, as Eric mentioned, around respiratory illness to help families know when they have to go to seek health care. And this is some of our communications have been done in partnership with CHEO. And we also have additional information on our website to help support individuals and families around respiratory illness. And so we hope that this will be helpful to addressing some of the issues with healthcare and capacity in our community this fall.
I think, Vice Chair, we will take that back to see what further communication we can do with healthcare providers as well directly. The primary care distribution list that we have, we do use to promote access to resources like guides for infection prevention and control in the office. We know the College of Family Physicians of Canada is also playing a role to help people be ready for the season. So I have seen communication go out to primary care providers about how to handle the upcoming respiratory season, but I think we can always add a local approach and think about increasing their capacity to make sure that they're serving their clients. I think in the materials Dr. Bournes mentioned, we do say turn first to your primary care office, so I think making sure that they're going to say yes, come in if needed, that's the other part. So.
And it is part of that switch, in my opinion, from thinking about COVID to thinking about respiratory illnesses. We've been dealing with respiratory illnesses for years, and so, you know, how do we get back to the basics and just reinforce our infection control? Great, thank you. Thank you.
Thank you, Vice Chair. Member Bauer, please.
Thank you very much for your presentation, very comprehensive. We heard passing references to risk assessment and risk mitigation strategies, whether it's accessing congregate settings or capacity issues or accessing vulnerable populations in the community. But I'm just wondering, sort of overall, sort of at the macro level, I mean, what should keep us up at night for the implementation of this strategy this season? Is it the variability of this COVID-19 strain on board, or is it the ongoing challenges in congregate settings? I'm just wondering about the big sort of risk factors that we should be thinking about. That may be a tough question.
I don't mind jumping in, but the team they're all experts in their area. I'm concerned about influenza in children is one thing. I don't think that our uptake typically in children of the influenza vaccine is high enough. And we have some indication that children are more likely to be hospitalized with the influenza that's coming our way. So I think we need to reach parents. We're going to be using multiple strategies. We'll partner with CHEO and others to do that. But that's heavy lifting to get more people out to vaccinate their children and youth, teenagers too. The other thing I think the team would probably highlight is we are concerned about long-term care homes and other congregate settings that don't have health care supports attached. So many congregate settings, retirement homes, people don't have that infection prevention control expertise on site. And it's in these settings where we see some of the worst outcomes. So certainly doing our part to make sure that people are vaccinated in those settings, but there's really ongoing work to stabilize staffing levels and leadership around infection prevention and control. It's not where we need it still.
Thank you very much, Member Bauer. Member Chung, please.
Thank you for that presentation. I just had a question, and it actually referencing what Dr. Etches just said about the kind of lower vaccination rates among children and youth in regards to COVID and influenza. Has there been any surveying of why that is? And also, I see that there's great work in terms of trying to increase the access to vaccines, but what about addressing personal factors such as vaccine hesitancy? And I know that ties into childhood routine immunizations as well, but I'm just asking particularly for respiratory viruses. And a second question I had was with regards to community-based measures. Is there any guidance that will be provided to community settings, schools, workplaces, outside of outbreaks? So in terms of prevention, cleaning, disinfection, ventilation, and occupational health and safety for workers. Thank you.
I can start with the vaccine questions. We want to increase the uptake of influenza vaccine for children. As Dr. Etches said, we will be reaching out to schools, to parents through the school system to make sure that they have the right information. In terms of vaccine hesitancy, our nurses are available. So our clinics, as well as our wellness hubs in the different neighborhoods, the nurses are available to answer any questions that people have. We are also working with our comms team to ensure that we have the appropriate information in all of our different communication channels. But we are definitely looking at increasing the uptake of influenza and COVID vaccine in a younger population. Now, I don't know if Jacqueline has any information about surveys as to, the reasons why that uptake is lower.
Through you, Chair Kitts. So the statistics that we use for influenza vaccination in children come from a national survey that was just done in 2021, which seems old, but it's the best data that we have because there isn't like a central registry for influenza vaccinations in the same way that there is for COVID. And that showed that about, I think it was 37% of children had received their vaccine. And, a little higher among those with chronic illness. But I don't believe there were any questions related to the reasons why they didn't get a vaccine. But I can confirm that as, we've recently received these data, so there might be more analysis that we could do on that. Thanks.
Hi, thank you. And for the other part of your question, we are working very closely with our different institutions, so whether it's school, childcare facilities, congregate living settings around preparedness. So a lot of infection prevention and control support, as well as helping them through kind of their preparedness and their response to the respiratory season, as well as there's a lot of information on the website that Eric went through around support for workplaces and how to keep your staff working and supporting them and maintaining that capacity.
Great, thank you. I don't see any other hands up, but very thoughtful questions from everyone, so thanks so much. And thank you to this team for answering our questions and for the presentation. Can we receive... I'll also note we have received 3 written submissions from Dwight Williams, Rachel Snellgrove, and Mike Buckthought, and they've been circulated by the Board of Health Secretary in advance of the meeting, and they will be referenced in the minutes and held on file with the Board of Health Secretary. So can we receive the report? Thank you. We'll move to our last held item, item 7.5, Operating and Capital Budget Status Report for Q2 2023, Board of Health for the City of Ottawa Health Unit Status Report. Member Bauer, I believe you had some questions. You can start us off.
Thank you, Chair. Just a quick point of clarification. In the meeting materials, document 2, it's a Q2 report. So on the compensation and benefits spend to date, made intuitive sense to me. We're at like 43 to 51% of spend. But on document 1, it didn't quite jive because the numbers were 80 to 126% in terms of our spend. So I didn't, in terms of the program spend, so I didn't quite understand how that correlated with the Q2 report. Perhaps, I'm sure there's a simple explanation.
Sure, I'll just ask Kibria to speak to the documents. And maybe we could also slip in here on the delegated authority. We do have the name of that courier, Member King. It's the PDS courier for the missing information in the delegated authority. And I don't know if we can just, we'll correct that for the record. Okay, sorry. So document 1, the percentage of compensation spent compared to document 2.
Yeah, thank you. So 126% actually represents the percentage of year-to-date budget whereas the other document actually represents the total annual budget. That's why you see, and year-to-date expenditure is more than 100%. Year-to-date means the June, end of June, because it's 2 quarters.
Yeah, and that made sense for the compensation and benefits. It was just on the first page. I didn't quite understand what the program spend was, if it was in the range of 80 to 126%.
So 126% what it shows actually here, and this is comparing what is the year-to-date budget for the program, okay, and what was spent actually compared to that year-to-date budget.
Okay, so it's a year-over-year comparison.
Yeah.
Then. Okay, got it. Thank you. There was a simple answer. Thank you. Yeah.
Great, thank you. I'm not seeing any other hands, so can we receive the report? Great, thank you. So we will move on. It's the end of our held items. So motion to adopt reports. Member Bauer, please.
Thank you, Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health 2023-24 Respiratory Season Preparedness Plan, 2022 Annual Report and Attestation to the Ministry of Health, 2023 Operating and Capital Budget Q2 Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, contracts awarded for the period of January 1 to June 30, 2023, and 2024 Ottawa Board of Health meetings scheduled to be received and adopted.
Thank you. Is this carried? Thank you. Do we have any motions requiring suspension of the rules? Seeing none, we have no notices of motion. Confirmation bylaw, Member Bauer, please.
Thank you, Chair. Be it resolved that confirmation bylaw number 2023-5, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of September 18, 2023, be read and passed.
Carried. Thank you. We have no inquiries. Meeting is adjourned, 7:46. Our next meeting will be Monday, November 6th. Thanks, everyone. Have a great evening.